rattle that saber, shoot first and ask questions later.
So one of the things I wanted to talk about is, there's a lot of things I wanted to talk about because cancer is a very complicated subject. And it's very, in a community, it's hard to know exactly what would be the best interface. Are people coming here for prevention? Are they coming here because they had a recent diagnosis? Are they coming here because they are a survivor and they want to prevent recurrence? So all of those things make an impact on what I would be talking about. So I'm going to try to cover it all as much as I can. So the mainstream medical model for cancer care tends to be very simple. It's kind of an oversimplified model. You have your you have your physician. Your physician tells the patient what to do. And it's kind of a very, oftentimes it can be difficult to have the opportunity to ask questions or to have concerns met. And from that model as well, the focus is really directly on the tumor. How do we remove the tumor? How do we kill the tumor? How do we prevent the tumor from coming back? Which is important. But from the integrative model, that includes that component of, well, what are we going to do about the tumor? But we're not forgetting about the patient. Okay? And the tumor is inside of the patient, and the main goal of addressing cancer is to support people in having healthy, long lives that are fulfilling and rewarding. And that requires more than just killing a tumor. Now, medical oncology is getting better. They are getting much, much better. So I'm not going to say that, the standard of care, the standard medicine is bad or evil or anything like that. But there are some people who have poor experiences, and there are some people who have great experiences when they enter that standard model. So the things that we can do to support the patient are pretty significant. Meditation, counseling, conversation, connection, exercise, healthy diet, healthy lifestyle, addressing issues in life that need to be addressed. That's sometimes something that's important. Community. These are all components. So the goals of naturopathic oncology are primarily supportive to the patient. Okay? So we're looking at preventing cancer through healthy lifestyle. Very, very important. And I'm going to talk a little bit about that. We're talking about early diagnosis through effective screening. So standard screening, in my opinion, is important. Is it perfect? No. They just recently changed the recommendations for prostate cancer screening. But at least they changed the recommendations. They studied it, they looked at it, and they said, something's here is not working. That's a really good thing. It's really important for me when I interface with patients with any condition, but particularly with cancer, that I support people in understanding what options they have. What are the advantages and disadvantages of different options, of different approaches? Another level of therapy is to improve the response and adverse effects of conventional therapies. So there are actual natural therapies that can be used in conjunction with standard oncology, with radiation, with surgery, with chemotherapy, that improve outcomes of those treatments. Why wouldn't we do them? And if applied intelligently, do not harm the effects, do not hinder the effects of those treatments. Why wouldn't we do them? And then, lastly, we want to improve long-term outcomes. And by that we mean decreasing cancer recurrence and improving survival. And there are natural therapies that have good research, evidence-based medicine, indicating that they do. And oftentimes, the adverse effects of these therapies are minimal. Not all the time. You have to be intelligent about some of the things that you do, especially when you're dealing with very toxic drugs that are not supposed to be in your body. They're not natural, but they have a positive effect. We have to be particularly careful at those times of what we use. So we're going to talk about prevention. And I think something that's really important is, at any point, I think it's really important for people to feel empowered, whether they're patients or not patients, whether they're ill or they're not ill. And I think that in regard to cancer, it's really important that people feel empowered because it's you have a lot of power over it. There is a lot that can be done. So about 70%, this is mainstream medical stuff, about 70% of all cancers are preventable.
Bang that drum, rattle that saber, shoot first and ask questions later. It just ain't practical.